Good evening, friends. So now exam is over. We are here to discuss these questions which has been asked. These are recall based questions. The one purpose to discuss these recently asked questions in this exam, to take insight, yes, what mistakes we have made, which questions are correct. Other than that, being a psychiatrist, I would like to say that now this is the period of this exam and result. This period should be utilized for your mental health, because you have suffered a lot, you have really worked hard, so much of stress was there. So in this period, you should be, little bit more relaxed. You should improve your health, physical and mental health, and you should learn new skills rather than wasting time in thinking what will happen, what would be the result. So never ever think about the result. You have done your job, and I know that you have done very nicely. Okay. But other than that, the purpose is that it will give you insight for those who are going to appear in the next exam. So they will know that how questions are being asked and how they are using the previously asked topic in the same way or a little bit modified way. So we start with question number 1. A patient had depressive and manic episode. Depression and mania means bipolar affective disorder, BPAD. In BPAD treatment, we give antipsychotics. And antipsychotics are having mood stabilizing property. So in this patient, manic depressive episodes are there, means diagnosis is BPAD, and now you want to prescribe antipsychotic. Okay. You can give me feedback if any modification is there, although I have collected these questions from my students. So, but if you have any other opinion change, then you can tell me. Which of the following has least weight gain? So antipsychotics, typical, atypical antipsychotics, we all have learned many times that olanzapine, clozapine, very high weight gain. This question has been asked recently in NEET 23. Why I am telling you like this? Because it will give you insight for those who are going to appear in next exam. This NEET 23, they ask the same concept, same question more or less. Yes, I am not discussing that question at this time, but answer was clozapine treatment resistant schizophrenia. The treatment of choices clozapine, and clozapine cause weight gain, hyperlipidemia, metabolic syndrome, means it is having weight gain. This time they asked question, they changed, means least weight gain. Yes, high risk, least risk, ziprasidone, aripiprazole. How to remember? Aripiprazole, patient becomes as thin as pipe. Olanzapine, patient becomes oval just like O. Closed chamber, phula hua. Yes, so this is olanzapine, clozapine, very high weight gain, aripiprazole, ziprasidone, low weight gain. Yes, all these are having moderate risk of weight gain. Let me give you reference of standard test book. Yes, Mosley, clozapine, olanzapine, high risk of weight gain. Chlorpromazine, yes, quetiapine, risperidone, paliperidone, moderate risk of weight gain. Low risk, amisulpiride, aripiprazole, ziprasidone. So in this, answer is ziprasidone. So again, I will point out this question. Yes, treatment resistant schizophrenia, that if two antipsychotics fail to respond, yes, then we say that patient is having treatment resistant schizophrenia and drug of choice is clozapine. Next question, very simple question. Yes, because options were not related so closely, so it becomes very simple question. Yes, a patient was admitted in hospital with chest pain, palpitation, for which no cause was found. So they give palpitation, breathlessness type symptoms are given. Sometimes they will try to deviate from the main topic. Okay. As we know, panic attack, there are palpitation, breathlessness, but don't worry. We leave this point for the time being. Now been given discharge, but he refuses to go back since his house was robbed by 10 days back on gunpoint. Okay. Before this event, patient was absolutely well. What is the condition is identified as? Okay, gunpoint was not mentioned. Okay, dear. Yes. Okay. Now, yes, 10 days back he was, yes, not going to the house. Now, in this question, patient is avoidance. So many things stolen from the house. Okay. Yes. Means robbery was there. Before solving this question, let me discuss post-traumatic stress disorder. Okay. In PTSD, I give example because this question can be repeated, and even if you will clear, these are important for NEET also. Suppose there is a person who bought a new car, he took all family in the new car, went to temple. As he reached temple, bomb blast was there, all family member died. Such a traumatic event. Robbery is traumatic event. War, traumatic event. After traumatic event, this person is having flashback. What is flashback? Yes, means same scene is occurring in front of her mind. Yes, in front of his eyes or her eyes. Yes, flashback. Nightmares. So nightmares are there. These are intrusion symptoms. Now he remain awake. He remain irritated. Arousal symptom. Avoidance symptom. He never use car. Never go to temple. Avoidance symptom. So if these symptoms are there after traumatic event and the symptoms less than 1 month, then it is acute stress disorder. If these symptoms more than 1 month, then it is post-traumatic stress disorder. So in this question, they have given a stressor, that is robbery. After this stressor, patient is avoiding to go back to home. So avoidance symptoms are there. In these patients, some anxiety symptoms, some depressive symptoms may be present, just like in this patient were there. Okay, so this is acute stress syndrome or disorder. Schizophrenia, you all know. Schizophrenia, duration of illness 6 months. There should be delusion, hallucination. No delusion, hallucination were there. So definitely, yes, schizophrenia would not be answer. Avoidant personality disorder. Patient prefer to remain alone. Okay, because of fear of being criticized. But you can exclude this answer because before this event, patient was absolutely well. You know, personality is formed in adolescence. This is persistent and pervasive pattern of illness. Means this personality disorder, you will find the symptoms should be present during adolescence for a long time. So this can't be answer. Yes, delirium, there should be disorientation, clouding of consciousness, confusion. When you find these words, then it is delirium. Delirium is organic mental disorder, neurocognitive disorder. So easily you can exclude these answers, and the answer is acute stress disorder. Now this question, delusional disorder. Okay, delusional disorder. You know, delusional disorder is false, firm, unshakable belief contrary to evidence, not supported by society. So definitely in this there is no false firm belief, so it can't be delusion. Very good. Yes, patient come to psychiatry OPD. He told the doctor that his thoughts and feeling are controlled. Yes, in this different students gave different points. Influenced by someone else, thoughts are being inserted. What is the condition? So if influenced by someone else, yes, this is delusion of influence. Other option you can easily rule out, delusion of reference. If somebody believe that anything happening around is related to me, anything happening around is related to me, that is delusion of reference. Second, delusion of nihilism. Nothing is left, everything is ending, world is ending, my intestines are rotten. Yes, this is delusion of nihilism. Recently asked question. Okay, delusion of nihilism, you will remember that if depression plus delusion of nihilism, then it is Cotard syndrome. Recently asked question. Othello syndrome or delusion of infidelity. Delusion of infidelity. My partner is not faithful. Yes, let me discuss few delusion. Delusion of persecution. Someone wants to harm me. Someone wants to harm me. Harm may be physical, financial. Delusion of reference, I just told you. Delusion of grandiosity, just like I am having power of Lord Hanuman. मैं ही Lord Hanuman हूं, मेरे अंदर बहुत पावर है. That is delusion of grandiosity. Okay. Delusion of love. Yes, if I say, yes, or better to say, if एक example लेते हैं, a rickshaw puller says that Priyanka Chopra Gandhi is in love with me. He has never met with Priyanka, but he says that I know she loves me, means this is delusion of love. Lower status के जो person होते हैं, they usually believe that person of high status love with them. It again, another name is erotomania. Erotic word. Yes, erotic movies are allowed, porn movies are not allowed. And Raj Kundra could not understand the thin line between erotic and porn and was booked. So you will remember erotic love. Declarambold syndrome, you will remember लड़की को देखा clean bold हो गया, declarambold syndrome. Nihilistic delusion, I just told you. Delusion of infidelity, another name is morbid jealousy, pathological jealousy, or Othello syndrome. Yes, if your girlfriend or boyfriend is talking to somebody else, you may be a little bit jealous. Little bit jealous is justified. But if you are excessive jealous, pathological jealous, then you have delusion of infidelity or morbid jealousy, Othello syndrome. Okay. Yes, yes. Okay. Now one question was, yes, I will take care. Yes, few students told that there was a question on thought insertion and schizophrenia. Yes, thought insertion, yes, thought broadcasting, thought insertion, thought withdrawal. That is thought alienation. Just like PK movie. मैं कहता हूं disorder of possession को याद रखेंगे PK movie से. Disorder of possession of thought, obsession as possession. Okay, mnemonic बन गया. Obsession and possession, similar letters. Thought broadcasting, thought insertion, thought withdrawal. What is thought insertion? Suppose I am teaching you, suddenly start abusing. You start saying, what are you telling, sir? Yes, you are here to teach us, but you are abusing. I said, no, I am not abusing. Somebody has inserted these thought in my mind. That is thought insertion. Thought insertion. Thought withdrawal. Suppose I stop speaking. You ask me, why aren't you speaking? I say that somebody has removed these thoughts from my mind. Thought withdrawal. So these are thought alienation. तो PK was alien, तो निमोनिक बन गया alien. Yes, तो alien के पास रेडियो थी. रेडियो में क्या होती है? ब्रॉडकास्टिंग होती है. Yes, PK मूवी में, yes, he removed all the thought withdrawal, thought insertion. So this is thought withdrawal, thought insertion, disorder of possession of thought. Okay, so you will remember this. So, and whenever you find thought insertion, thought broadcasting, thought withdrawal without second thought, the diagnosis is schizophrenia. These are Snyderian first rank symptom. Okay, so I have taken fifth clinical psychopathology, and in this there is an entity that is delusion of influence, and they ask question on the delusion of influence. My thoughts are, feelings are being controlled or influenced by somebody else. Okay, dear. Next question. Yes, Patient was consuming a substance after which patient has tachycardia and see red color when he hear the radio music. You must have experienced. तो इसके ऑप्शन बताना यार. Okay, you must have experienced after yes taking bhang LSD. Yes, colors are being heard. Yes, songs are being seen. क्या कहा मैंने? Colors are being heard. Thoughts. Yes, songs are being seen. So in this, yes. This is reflex hallucination. Reflex hallucination. Many times question has been asked. Yes, let me describe this reflex hallucination. Suppose a person says that normally I don't see pen, but whenever I hear sound of ringing bell, I started visualizing pen. That is reflex hallucination or synesthesia. Reflex hallucination or synesthesia. Syn means combination. Syn means combination. Aesthesia means sensation. Combination of sensation, two sensation. A question was asked long time back. A person says that whenever I hear the sound of closing door, I feel vibratory sensation in my genitalia. Means perception in one modality and hallucination in other modality, and it is commonly associated with LSD. And LSD use can lead to tachycardia also. So answer is LSD. Now, functional hallucination. Hallucination means, functional means perception in one modality and hallucination in same modality. Same modality. Means suppose a person says that whenever I see pen, I also visualize knife in my hand. Means perception in visual, yes, stimulus in visual modality and hallucination in same modality. That is functional hallucination. Okay. Now tactile hallucination, just like after cocaine use, that is cocaine cockroach. Yes, cocaine use, cocaine cockroach, cocaine use lead to tactile hallucination. What is complex hallucination? Perception in more than one modality. More than one modality. Okay. Just like you must have seen Lage Raho Munna Bhai. In Lage Raho Munna Bhai, yes, Sanjay Dutt used to see Bapu and hear Bapu. That is complex hallucination. Thank you friends for this is about the session of PYQ. Thank you. Best of luck for your result.